When should it show up on YouTube?
I don't know. As soon as it does, I know we're live.
Okay.
So I'm refreshing over here as well.
Me too. I don't see it yet.
Tell you what I'm going to do. We'll keep standby. I'm going to go to this, share. Still not there.
It says recording live on YouTube in the corner.
Yep, it is. It's a little bit lag, so we'll give it some time.
It does say recording live.
No.
Yeah, well, that's just recording.
Okay, it's on.
It's on? Awesome. Hey guys, if you guys can hear me on YouTube, we're getting ready to go live. We're just setting up a few things. Just stand by.
It says we're live.
Okay, good, awesome. We'll get it going. I want to I got to open up the chat window over here and do a couple things before I get started here. Well, so we're there. I trust you. Yep. Okay, so I'm gonna I'm gonna wait a few minutes. Hey guys, in the chat window there, if you will put the city that you're from so we can know where everyone is. Do you see the chat window, Amy?
Yep, I see it. They're already doing it.
Okay.
On their own without you even saying it.
Okay. If you'll do that, just put where you're from. That's going to give me time to get my moderators going.
I want popcorn. Someone said we need popcorn.
No, cool. Can everybody hear us?
Yeah, they can hear us.
Oh, cool.
They're going to see us. Got Charlie in the house, Dr. Joe, and Nurse Amy. And we'll get started. We need to wait a few minutes for everybody to join. So
Yeah, why don't you come closer to me?
Oh, I was wondering what that was.
Yeah, use my. You can use my.
You know, I can move the camera over a little bit.
No. It's
Let me move it a couple inches.
Leave it the way it is. I think it's good.
You're happy?
No, I mean,
So should
I see you, and I see you
should
really
move it
clearly, and
over
I
like-
see me. So
I see too much of you, Joe.
yeah, I know. How does that
There you go.
Oh,
There you go.
That's got to be better.
I'll hide him. Here's my filter material.
There we go.
Okay, I'm going to go ahead and we'll get started in a second. Like I said, wave, yay.
Lots of good folks
I know, from everywhere.
Yep.
Denver, Colorado, New Jersey, New York City.
Waynesville, hey.
New York City, I may need some help with my daughter in Brooklyn. Help evac her.
That's near Gatlinburg.
What is?
I think Jen's Carolina readiness is in Waynesville.
Yep. Or Henderson?
No, Wenderson. No,
Waynesville.
there is a Hendersonville, but
Fredericksburg, Virginia.
oh, we
Awesome
were there.
place.
We've been there. Mhm.
Lots of California.
Yeah. Oh, lots of California.
Look at
That's
that, yeah.
great. Oh, good for you guys. A lot of folks from North Carolina.
Richmond. Oh, we love Richmond too.
Oh, yeah.
We love all, we've been to a lot of these places.
Yeah, we sure have.
or at least driven through too.
Uh-huh. Sure have.
Charleston. Remember there was a show in Charleston, South Carolina?
Good to have you here, Susan.
Yes.
Thank you, Mark.
So I'm gonna make some changes real quick right here, if you don't mind.
Uh-oh.
We're getting ready to get started.
Jacksonville, Florida.
All right, fellow for a reason.
Connecticut. Wow. Jonesboro. I lived
I
in
see some
Jonesboro.
Kennesaw in there.
Yeah.
Yeah.
Where was this
Up here
jump?
by me.
Oh, yeah.
Uh-huh.
Oh, Charlie, I talked to a customer who called, or he just wanted some advice. And he's like, I live in the busiest place in Georgia. I said, I bet I know where you live.
Yeah.
I said, I
Yeah.
bet you live in Cumming, Georgia. He goes, yeah, how'd you know? I said, I tell you what, I have 2 birthday cards in the mail right now, haven't been picked up
Yep.
yet, that are addressed to 2 little kids in Cumming, Georgia that are having
You got
birthdays.
them. Thank you very much.
Oh,
Yeah.
did
Very
you?
nice.
Did
Yes.
the music work?
Well, yes. So just so
Okay.
we're waiting for her to come back from vacation.
Okay,
Still some of
guys.
hers, but Mason got to see.
This is not a personal call. I'm gonna get started, okay?
Okay.
You guys talking shop here. Okay. Hey, I want to welcome everyone to the PrepperNet live video this evening. I'm going to go through a few slides, then we'll get right into it. But thanks for stopping by. Thanks for sharing with your family and friends. And tonight, I just want to welcome everyone. I see that everyone's from all around the United States, and that's a good thing. And what we're going to do is bring you some facts, maybe help you prepare for nothing or something big. We don't know. We're not here to spread fear. We're here to educate. My name is Forrest Garvin. I run an organization called PrepperNet, but here's a little bit of my background. Everyone always tells me I need to do this, and I never do it. I'm a former military, former banker, survival instructor, NRA instructor, ham operator, Krav Maga instructor, speaker, educator, radio podcast, author, founder of PrepperNet, and I'm also the CEO of Sun Ovens International. A little bit about me. I founded this organization called PrepperNet. PrepperNet is an organization of like-minded individuals who believe in personal responsibilities, individual freedoms, and preparing for disasters of all origins. A pandemic is a disaster. The group is aimed, you know what? I went backwards. What we do is we have meetings throughout the United States. I'm going to show you, I'll show you a map throughout the United States so you can meet other like-minded individuals. Meeting people on the internet is great, but it's not real. You need to sit across the table and meet other like-minded individuals. So we have 67 meetups throughout the United States. We got 30,000 members. And there's one near a city near you. And if there's not, let me know and we'll start one. I do want to thank, there's a few people I need to thank before we get started. And one is my expert panel. These people have helped me kind of organize this PrepperNet over the last year and a half or so, but it's John Jacob Schmidt from Amron. He's going to be on tomorrow night. No, he's going to be on Saturday night. Jonathan Hollerman from Grid Down Consulting, he'll be on tomorrow night. Scott Hunt from Practical Preppers is going to be on Tuesday night. Dr. Bones and Nurse Amy is live in the house. Charley Hogwood, live in the house. Glenn Tate and Shelby Gallagher, they're going to be Sunday night. Sam Kopler is coming on Saturday night with John Jacob Schmidt. And then Rick and Jane Austin, Survivor Jane and Rick, we're scheduling theirs. We don't know yet. We're going to talk tomorrow. And we got Franklin Horton and Ryan Mitchell as well. There's the map. I do want to let you guys know that I am the CEO of Sun Ovens International. The Sun Ovens, we make an appliance, just like you see there, that saves lives around the world. We're committed to, I don't know if you know, but 1/3 of the earth still uses wood to cook. And one, there's deforestation, and 2, it's really unhealthy. Matter of fact, one of the leading causes of death in the continent of Africa is respiratory infection or disease because the children are in these huts where their mother is cooking, their food. You've seen the little huts, they're in there, they got a little oven, with their burning wood. And a lot of times there's no trees anywhere around the village. So these things save lives around the world. And a lot of people, preppers, we love these things because it can cook just like your oven. You can dehydrate, you can cook just like your oven. It browns bread. It's amazing. For this special offer, I'm giving $70 off if you want one. If you don't, that wasn't why. Since I use their mailing list and I'm their CEO, I got to offer a deal. It's just got to do it. If you go to Sun Oven and use the coupon prepared, you will get $70 off to the Sun Ovens we have there. It's a great company. Every time you buy one, it supports us and lets us put one overseas. I mean, not one for one, but it does help us get more overseas. And that's our whole goal, is to really save lives and let people live a healthier life there. Next thing is one of my sponsors got a really quick Sawyer water filters. You guys, I know you guys have seen these. One of the best filters. I'll be honest with you, that filter does not filter out this virus though, but anything else, it probably will. Next thing, Retreat Realty, a huge sponsor of ours. If you're moving to the mountains, North Carolina, Tennessee, or Georgia, John Haynes is your man at retreatrealty.net. He's been a sponsor every year we've been out there. That's my sponsors. Just wanted to get that over. I do want to tell you that I do a podcast called the Prepping Academy. It is mediocre. It's mediocre.
Not true.
But we have fun. We've had Dr. Bones and Nurse Amy on there. Have I had you on there, Charlie?
No.
Oh. I get the A list only.
Apparently not.
But it's the prepping.
Charlie is A-list.
Yeah. Prepping Academy, and you can find it on all the different, iTunes, Stitchers, and all that. Again, it's a good way to waste an hour or so a week. So anyway, check it out. If you like it, give me 5 stars. If you don't like it, find another podcast.
There you go.
So here's the schedule that we're going to do that we put together. Tomorrow night, Jonathan Hollerman, Grid Down Consulting. Go buy his book right now, because I'm telling you, it's one of the best books I've ever read when it comes to, it's called Survival Theory. And Lisa Bedford, Survival Mom. Everybody remembers her. And then Saturday night is Samuel Kopler from Forward Observer. John Jacobs. Sunday is Glenn Tate. He wrote the 299 series. Shelby Gallagher, she wrote the Great State series. And they do a podcast called Prepping 2.0. And then you can see on Monday, I got Jeff, Christian artist. And on Tuesday, I think that says Scott Hunt. Does it say Scott Hunt down there? It's not on my screen. Yep. Okay.
Yes.
Scott Hunt. And I think he's in the house as well. And I think Jonathan's in the house. I've been seeing some of these guys join. So I do want to say this. We're not here to spread fear. And we're here to help you be better prepared. We're not here to really sell anything, even though I did the Sun Oven thing. We're here to educate you. I've got some of the best experts in the entire world coming to speak to you guys over the next week. These are the experts in the industry. But I'm telling you, God has not given us the spirit of fear. We're not supposed to be afraid of a virus. We're not supposed to be afraid and live this way in fear. I mean, even if you can't get like an N95 mask, you need to have the knowledge and you need to have the wisdom to be able to protect your family in all circumstances. That's why, that's really the reason I got into preparedness and prepping, is to protect my family. It became a hobby, but I love my family, and it's like setting the savings account. And everyone does that. Everyone has insurance. This is kind of like insurance. Just imagine if you've been prepping for the last year, because I know there's a lot of new people in here. If you've been prepping for the last year and reading a couple blogs and doing a few things, you would not be scared right now. You would go, okay, we can deal with this, because you would have the mindset, you'd have the knowledge of how to handle this. But God did not give us a spirit of fear, but the power and the love, and with a sound mind. That means that we have a sound mind, that we can do what we need to do to take care of our family and be self-sufficient when we need to do it. I just had to do that. And because I'm doing this, love you guys, and I mean it. And I'm going to show you. So I wrote a book called The Case for Christian Preparedness. It's thin. Okay, let me just show you this. Joe and Amy's book, my book. So it's a tiny little book, but it is free starting tomorrow on Amazon. You can go and download this thing for free. And I think you need some kind of Kindle reader or something, but it's free. Did I say that? Free tomorrow, all the way through the weekend. And it's a case for Christian preparedness. And I go through the Bible, and I go through stories in the Bible, because a lot of my friends at my church say, hey, I'm going to just trust God. Well, all of a sudden they're trusting God right now. And they're like, well, I need an N95 mask. And you can trust God, and God will be there, but he gave us a mind, and he gave us knowledge that we need to do things to be prepared for things like this. So anyway, that thing is free. I hope you guys enjoy it. If you like it, give me a 5-star review. If you don't, read Charlie's book or Dr. Bones and Nurse Amy's book. Okay. With that said, we're going to get right into this. This is going to be like a question. I'm going to ask these guys questions. I came up with questions I think that every new prepper or experienced prepper, they're asking. I've been watching on the forums. I've been watching on Facebook. They've been asking me in my church and just at work. These are questions that a lot of people, so you've been watching Fox News or been watching the CDC or the WHO. They just tell you facts about what's going on. We're going to go into facts about how to protect your family. But I have Dr. Joe Dr. Bones and Nurse Amy. These two guys have been friends of mine for a while. They've written books. They got books out galore that can help you. They also run their website is called Doom and Bloom. There's a doctor and a nurse. These guys know what they're talking about. They've been in the preparedness community. How long you guys been doing this?
Well, let's see. The Survival Blog published my first article in 2009, right?
2009. So 11 years. So they've been doing this for 11 years. They take a different approach than some of your normal doctors on some things, correct?
Oh, absolutely. We step outside the conventional medical wisdom an awful lot. I mean, right. But we still maintain active medical licenses in our home state of Florida.
So there's 2 books. They got the Survival Medicine Handbook. And then they also have the one I told you guys the other day I ordered it, didn't you? Remember I texted you because I didn't have this one.
You did.
Yep.
You did.
So go visit their websites. They have products for sales. They have kits for sales. They have Charlie, you okay over there?
Yeah, I'm good.
Okay. And so next is Charlie. So
I'm
Charlie is the man. So Charlie wrote a book called Survival Groups. That's one of the things the PrepperNet specializes in, is putting groups together. Charlie wrote the book on it. He also does survival dispatch. And then when I'm finished this, guys, then you guys can jump in and kind of tell more about yourselves. But Charlie, he's been he's done about everything. He's got like every cert certificate in the world. I think he's managed FEMA for 40 years. I don't know. This knowledge is crazy. And so we're going to be talking about him, about what's going to happen in a city, what's going to happen, what's the government going to do. So let's start with Charlie right now. Charlie, tell us a little bit more about yourself before we get into the questioning.
Sure. Hey, everybody. Charlie Hogwood here. I am currently the editor-in-chief for Survival Dispatch Insider Magazine, which, if you're looking for some high-quality information, we are a digital-only magazine with no advertising. Anywhere from, right now, we're running almost 100 pages of highly polished graphics and hundreds of videos and all kinds of access to Chris Weatherman, Angry American, Alan Kay, all those other guys. Those are all my people. And I have a lot of writers that put together a lot of great information for the magazine. So personally, myself, I'm the local CERT director for my county. I'm a CERT team leader. I've got 60 something CERT training certificates, everything from weapons of mass destruction to field epidemiology inspector, like everything. So I've got 15 years in the U.S. Army as a scout. And I've been running personal readiness education programs since about as long as Joe and Amy have been doing Doom and Bloom, because we were
Yep.
friends at the beginning.
Yes, that's right in the beginning.
So we started that up. So at readygoprep.com. So I focus disaster and survival consulting, not so much rubbing sticks together anymore. So now it's contingency planning and food storage, security assessments, drone work, or orthomosaic photography with the drones for retreat locations, retreat planning, and all that. So that's the short. And I'm getting ready to start firefighter training. I just had my first meeting on that tonight.
Nice.
You are full of surprises.
Yeah.
Okay, Dr. Bones, Nurse Amy, go a little bit more in depth of what you guys are all about and what you do.
Well, we're retired from active practice. I'm a life fellow of the American College of OBGYN and also a retired fellow of the American College of Surgeons. The lovely Nurse Amy is
I'm a nurse practitioner.
Advanced registered nurse practitioner.
Yes.
And a
certified nurse midwife.
That's right. And we practiced together for many years. And we've been married for many years, and all the way into I'm well into my second childhood.
Yeah. I just want to say something about prepping. I grew up with a father who was in the Air Force, and we prepped. We jarred food and made beef jerky, and we went camping, and we learned how to forage and figure out life on our own. So I've been prepping pretty much my whole life. I know we talked about how long have we been doing this. What we've been doing in this phase is a very serious prepping, but we live in South Florida, and I've lived here since 74. I think you've been here since 70.
Since 68.
So our families prepped for hurricanes every single year. So, you know, we've been doing this our whole lives, prepping.
A lot of our fellow Floridians are hurricane preparedness preppers, and so certainly more prepared than the average folk.
Right.
And our website, doomandbloom.net, we keep a lot of new content on there. We have over 1,200 articles, podcasts, and videos for your education and entertainment, for your edutainment. And so feel free to check that out.
Awesome. So we're going to get started. Hey, thanks for being on my expert panel. You guys have been really, really good to PrepperNet and to the prepping community for years. And I do want to thank you guys for the time and everything you've done for us. So I'm going to start out with a few questions. Some of these I have written down, guys, and some of them we'll just kind of talk. You'll notice that we like to talk and cut up, but sometimes this is serious. But sometimes, we do like to have a good time, because I feel pretty comfortable with my preps. You guys do too. So. And we apologize if we don't mean to offend you if we're joking around about this serious subject. So the first thing I want to ask you is, tell me what your thoughts are on this virus. We got this virus that it's not, well, if you look, some days you look at the news, it's taken over the world. We're all going to die. And other days you watch Trump yesterday, he just kind of made a 180-degree turn and said, well, it's not that bad. Don't worry about it. We got it handled. So tell me, from your professional opinion, what you guys think.
Well, I think, let me start by just introducing the subject. I think most people know the basics, but if you just returned from your honeymoon in Antarctica, well, I want to tell you what's happening. Basically, we have a disease called COVID-19, and that's the name given to a viral disease that's caused by a brand new virus that's just been discovered in the coronavirus family called coronavirus 2. And this began in mainland China. And I actually wrote an article on January 7th where I talked about this new pneumonia that was showing up in mainland China. Right. There were 60 cases and no deaths. And here we are about 7 weeks later, and now we have 83,000. I have the figures here: 83,379 cases, 2,858 deaths. And sure enough, the virus has spread to more than, I had actually this morning when I first looked at the statistics, it said 48 countries. Now I see it says 54 countries. So it's spread to a bunch of different countries. And it's proven to be a very highly contagious virus. It has what we call an R0 number close to 3, and the R0 is what's called the basic reproduction number. That's how many people would catch an infection if you tossed one infected person into a population that had never seen the disease. And so if each person infected 3 other people, it's very likely to cause an epidemic and that goes out of control. And currently, COVID-19 R0 is between about 2 and 3. In other words, pretty darn contagious. So what I think about the virus right now is it's interesting that the hot zone in China, where the grand majority of cases are, well, it seems to be cooling off. And I've seen as little as 15 new cases reported. Of course, if you can believe the figures from the Chinese government, 15 new cases reported in a day. Today there were 335 new cases though, but still that's a lot less than what we were seeing when there were jumps of 15,000 cases a day in the early going. But in the last week, we've had many more cases show up outside of China than inside China. And that is what is disturbing. What's happening is you may be seeing a epidemic on the wane, in other words, on the far side of the bell curve in China, but just the initial stages in other countries. South Korea, for example, yesterday had 1,260 cases. Today it has 2,022 cases. That's an increase of 761 cases. What's that? 50%, 60, 70% increase, or about 50% increase, you know, just in one day or more. Italy has had 420 cases. Now it has 185 additional cases, now 655. And these folks the death rate is about 2 to 3%. I'm seeing here throughout most countries, except for Iran. Iran has 245 cases. Yesterday it had 139, but they have 26 deaths. That's more than a 10% death rate. And that's very unusual. And what that says to me is that, you know, we know that that's sort of a totalitarian regime. We know it's not a very transparent country. And that means to me that there are thousands of cases there that are not being counted.
Right.
And also, we haven't heard a thing about North Korea. Imagine what kind of shape their medical infrastructure is in North Korea. And we haven't heard about one case in North Korea. I'll bet there are tens of thousands of cases in North Korea. So that's what I think is going on. You've got a bunch of different epidemics all leading up to being a pandemic. And US health officials and the World Health Organization, they're very reluctant to call this a pandemic, but the World Health Organization's, their actual definition is their phase 6 alert is pretty much level of pandemic is when you have community-wide epidemics in a number of countries in the same region, and then epidemics in different parts of the world. So we got an epidemic in Italy and Europe. We have an epidemic in Iran and the Middle East. Now we have, and of course, you know that we have epidemics in China, probably North Korea.
So let me ask you this. Is this just like the flu? Because that's a question, and I've heard that throughout some of the media. It's just like the flu.
Well, some people have said that. I've heard the same people you have, and indeed a good number of patients have a flu-like illness, but there are differences. For confirmed coronavirus cases, COVID-19 cases, symptoms are sort of similar to a flu. You start off with a fever, it comes on relatively suddenly, then it's followed by a dry cough, and then about a week down the road, some people get shortness of breath. And the problem is that what is not like the flu is that in 1 in 5 or 6 cases, the symptoms are bad enough, the shortness of breath is bad enough to require hospitalization. You may have chest pain, you may have other respiratory issues. A percentage of these folks that wind up in the hospital end up dying from the disease due to respiratory and organ failure. So you probably agree with me that 1 in 5 or 6 flu patients, if you had 1 in 5 or 6 flu patients that needed hospitalization, we'd be stretching even the US medical infrastructure to the limit. But luckily, the flu just doesn't get that severe in the grand majority of cases. It kills patients probably about 0.1% of the time. That's 20 to 30 times less than COVID-19 does. Now, I want you to note that the typical flu or the common cold, that's characterized by a lot of muscle ache, joint ache, a lot of nasal congestion. These are seen much less often with COVID-19. So basically, this is what we got. We have a virus that seems to last a long time on surfaces, several days, maybe up to 9 days, and some people have said. The incubation rate is between 2 and 14 days on the average, but there are outliers from 0 to 27 days. So it's very difficult to tell. There's even questions as to whether people are being reinfected, or if they're, because the people have gotten sick, gotten better, and then gotten sick again and tested positive, then negative, then positive. Now that could be a factor of it's a new disease and we don't have a test that's as accurate as it should be just yet. That's a possibility. But, well, you know, all I can say is that the good news is that about 81% of these infections are mild infections, just flu-like symptoms. You can recover at home. About 13.8%, however, are severe, and you wind up in the hospital with pneumonia and shortness of breath. Has actually a very typical look. Usually it's a bilateral, or what they used to call double pneumonia, and shortness of breath. Pneumonia is the inflammation of the lungs, and the little tiny air sacs in the lungs, well, they fill up with fluid, making it difficult to breathe. 4.7% are actually in critical condition or in trouble, need respiratory support, and about 2% of reported cases, maybe 3%, wind up being fatal.
A quick question that I've been reading is this doesn't affect children as much as the flu. Is that correct?
Yes, that's actually one of the good things about it, or if there's anything good about it, is that it has affected relatively few cases of children. Most people are older, and most people have respiratory or have either lung, heart disease, diabetes, things like that. Basically everything that I am. And so
you're healthier than you say.
And I'm healthier than I say.
So let me ask Charley a question. Charley, I read the other day that our medical, and this is a blind shot, by the way. Take it. Our medical staff in America is short 50,000 workers. And you've worked with, you know, government agencies and CERTs and all this. Is our healthcare system, do you think, ready for something like this? If it did become somewhat pandemic?
Well, that's a big question. And I think we experienced some of that when the Ebola threat came around. And I think it was a bit of a learning lesson. And a lot of lessons had been learned. So sure, I mean, and it depends where you go. I mean, you're going to have shortages of employees and labor in various regions. But from what I've seen in health departments and in areas where I've worked, they're all keeping up with it, and they have a way to bring in some surge capacity too. So Joe might even be better to answer that one as far as qualified staff. But as far as what I've seen for people, there's always been a need for nurses. There's always been a need for medical professionals everywhere you go. But I think that we did learn some lessons from the Ebola outbreak that happened just a few years ago. So I would like to think that maybe we've patched those holes and we found a way to complement that surge.
That's interesting, because her name was Nancy Wrightbowl, if y'all remember. And you wonder, how do I remember that name? We went to church together.
No kidding.
Here in Charlotte, North Carolina, yes. And we went to church together, and we actually at one point was youth leaders together, and her kids were in the youth group. So but I do remember that when that all happened. So it doesn't affect kids, but it is affecting even middle to does it, let me ask you this. How about the battle of the sexes here? Does it affect women or men more?
71% men.
Yes. So 71% men. So why is that? Come on.
Well, we don't know. There's a lot we don't know about this virus. I guess it could be societal and cultural, it could be that men are out and about more in certain countries than other countries.
Or did women make
this? For example, no, men are, what I'm saying.
Did women make this to get back to it?
Yes, right. They tell us to go out, get to work and bring home some money, right?
No.
But it's true. If you think about it, in Iran, I would guess that a theocracy based upon Islam probably has a lot of limitations on women. They probably have to spend much more time at home than the men do over there. So I really feel that a lot of that may be cultural.
Okay. Okay.
In nature.
So we don't want to get this. So let's talk about the immune system. What are some things that we can do to build our immune system? Because will it attack healthy people and unhealthy people the same?
That's unlikely, but we did hear about a 29-year-old doctor who I have to assume was in probably pretty good condition since he was working in China, and he's 29 years old. He died. I mean, it's not always the elderly person. I don't know if this guy had comorbidities, maybe he had diabetes, or maybe he had other issues. I don't know his health status. I just know that he was 29 and he passed. But yes, absolutely. Immune system is our best bet. We don't have medication for this. They're trying out different things. We don't have a vaccination yet. And even if we do, there's probably a lot of people that won't get it. We basically are our own soldiers. So what we need to do is keep our bodies healthy. We don't want to drink too much alcohol. We don't want to smoke. We want to stay a good weight. We want to eat nice, healthy foods. Of course, shop the outside of your grocery store, which is where you have the fruits and vegetables, the dairies, the meats and fish. You want to have a nice variety of diet. Anything you can do to keep out preservatives, keep out high fructose corn syrup, keep out antibiotics. All the things that you hear in the news about a healthy diet. And I'm not saying you have to be keto or paleo or anything like that. Just have a sensible diet.
How about anything you can take to help you boost? Is it vitamin C?
Antioxidants in general are a great idea.
Absolutely. Now, as far as vitamins go, there's been some studies that said, well, not everybody needs to take vitamins, and that's true. But as an older adult, what they have found out is that they're not as hungry and they don't have the appetite. And so the food that they are eating might be healthy for their diet, but it might not be enough. So consider a supplement for your older generations, your parents, whoever is older, aunts and uncles. Take a look at what they're eating and maybe kind of give them some extra nutrition. They have the supplements, the drinks that they can drink, maybe a boost is something they might want to have at 2:00 in the afternoon because they just weren't quite hungry to eat lunch. But definitely vitamins like C, D, zinc. So sunlight, you can get the D. Milk products have D added. Of course, C is found in citrus, spinach, broccoli, red peppers. You want to have some bananas for your potassium. I mean, all of these colorful, delicious fruits and vegetables. Try not to cook them too much because overcooking food removes those healthy things. So if you can make a salad with some, a little olive oil and maybe a little bit of vinegar and, some herbs, maybe some cilantro is
salads.
Really good. You won't eat rabbit food. Sorry. Other things to consider are selenium and magnesium, but these things help build the body. Now, when you're sick, there's been discussion about elderberry. I firmly believe it. They have looked into it. It does build the immune system. Echinacea, also Sambuco syrup. Really good stuff. We just bought some from Costco. Okay, it comes in a 2-pack. That's really good. There's a lot of herbs: turmeric, ginger, garlic. I have a whole list of them.
There's a bunch of ways that we can build our immune system. But
exactly.
That doesn't guarantee that we're not going to get it, though, right?
No, even the healthiest person can wind up getting it. If somebody with a bad case of COVID-19 walks up to you and sneezes and coughs in your face, well, you can certainly get it even if you are a triathlete.
but it doesn't mean you're going to get sick. 80% of folks have
might get a
mild
case.
symptoms or even no symptoms, which is really kind of scary because there are people that are walking around in this world in different countries, maybe not even in the areas that we know of, that have this, and they don't even know. So they don't know they have it. So therefore they're not going to go to the hospital. They're not going to get a test, and they'll never know they had it. But somebody they came in contact with may also not have symptoms and then come in contact with someone else. And, 4 or 5 people down the line, suddenly someone gets really sick and they don't know where it came from. But there's a trail of people who had very mild symptoms. They thought, oh, I just have a cold or I just have a flu, because they didn't have the respiratory problem, the fever. This is when it's severe, they can tell that it's not that flu. But when you have mild symptoms, you just may not know.
Hey, Charlie, grab your mask. Come on.
Which one do you want?
Come on, because we're going to, I got some questions about masks.
You want one of these? That's for a different video I got to do.
A heck of a mask there.
Yeah, so is that so people are, masks are being, people are charging 4 or 5 times more on eBay. People are going to look for them in Lowe's, Home Depot, drugstores, and they're not finding the mask. Charlie's getting ready to do some reviews on some masks, but tell me the N95 mask. That's what everyone has said. N95. Tell me why it works and why it can protect you from getting this disease.
Go ahead, Joe. Why don't you cover the surgical side of the masks?
Okay, no problem. And
I'll do a
N95
video on it tomorrow.
All right, cool. An N95 mask is also known as a respirator mask, and an N95 is able to block 95% of airborne particles that are over the size of 0.3 microns. Now, to get an idea of how small that is, let's make believe that this dinner plate is a human hair that I've cut in cross section. Well, a grain of pepper on this plate is 3 times bigger than 0.3 microns. So you're talking, and this is a human hair that I've just cut in cross section. So you can imagine exactly how small that is. So an N95 mask is great for airborne particulates. It is a good way to protect yourself from things that are just floating in the air. That depends too, by the way. An N95 mask is only as good as the fit that you have made on it. And the kind of fit that you need to make on an N95 mask is a good solid fit up front. You want to use both hands to apply pressure to the mask here to make it molded to your face, get it down below your chin. And of course, you want to put your straps, your little.
So let me ask you a question. A lot of people don't have an N95 masks. They've gone to the store, they can't find them. They go on eBay and they're $300 for a box of 10.
There certainly is a scarcity of N95 masks for us, and at least among the general public. And the industry that keeps them in medical supplies, well, honestly, many of them are made elsewhere. And guess what? The majority of medical masks that we import from China come from Wuhan, which is the epicenter of the pandemic.
And they're not making masks right now.
And they're not making masks. And not only that, the government has mandated that there are no medical supplies that are personal protection gear that can be exported from the country.
So you're telling me the U.S. government, because we do have one facility in America that makes them. He only makes 7% of the market in America. And he said it would take him almost a year to double his production. Because
that's probably true, but we do have a strategic national stockpile.
Okay.
We have a national stockpile of medical items for peacetime type disasters, something like this. And it has a repository of large quantities of medicines, vaccines, other medical supplies. Guess what they have? They have 30 million face masks in the strategic national stockpile.
That didn't seem
The problem is, Forrest, with it is that those masks aren't for you and they're not for me. They are meant to maintain the continuity of the government. So it is unlikely that the average citizen are going to wind up getting access to any of these masks.
No.
So with that said, and Charlie, you can jump in anytime. With that said, Americans, when they sell off the shelf for the ordinary people like Charlie and I, we're not going to be able to buy them. That's why Charlie has all these deaf masks that people get tattoos on their arm and stuff like this. But you got all them just
I'm just prepared for a lot of different events.
Yeah. So what happens if a family can't get an N95 mask? What can they do?
Well, if you go to Home Depot, there are different types of masks that are also good. There are reusable N95s if you're willing to make a bigger investment that have disposable filters. These are more expensive, but they
probably has
them at
some.
the local. Had them at the local Home Depot and Lowe's the last time that we looked, and some of them are full face masks, sort of like what Charlie has, but they have it's just glass.
Charlie can
plastic.
show you
He'll
those.
show,
He has a.
Yeah, he probably has one of them.
Well, I got this one handy.
Yeah, okay, there you go. That's exactly what I'm.
So so this one's got a little bit more of a
That's
aerosol.
$150 or more, isn't it?
Yes, they are expensive.
Yeah, these are.
But think about what you just said, Forrest. The N95s are $300. Think about what you just said, but you can get one of these and reuse it instead of having to dispose of them.
Put that on.
Well, another important topic, though, when it comes to masks is the mask is a layer of protection, but honestly, your hand washing and general hygiene are going to go a long way to preventing all of this, along with some social distancing. So you don't have to go out and spend a bunch of money and buy these big fancy masks if you can manage to stay away from people.
You're absolutely right. And I was actually going to mention about the masks. We get a lot of questions from folks about children, and I can't find masks for children. Honestly, folks, if we get on a lockdown and there's a quarantine, you're not letting your children leave the house. They're not going to go to school with a mask on. They're not going to go to the grocery store or the playground. They're not going to leave your house because that's how you protect them. So there's not going to be a situation that you need to put a mask on. We don't have to evacuate cities because of this. What we're all going to be doing is staying home, which is why the public has been told a couple of days ago, we're not trying to scare you folks, but you do need to prepare. So you need to get those supplies that all of us preparedness folks have been talking about for 10 years.
Okay. So the pandemic's in my community, and I forgot to get extra medication from the drugstore, and I don't own N95 mask. And I walking there, I know my drugs are there, my prescription. Is there a way? What would I do if I don't have one? Can one be made?
Okay, so I don't think that, we can't officially know that any of our MacGyver masks that we're all trying to think of right now, and I have one in my lap I'm going to show you, we'll never know because we're not going to submit them to safety and health, NIOSH, for approval and certification. But we can put layers in and hopefully have a seal. But the biggest thing for me is having face protection, so that whatever mask I have, if somebody is coughing and sneezing, at least I'm not getting the aerosol droplets in even to my MacGyver's mask. So what I did a couple hours ago, because I put up the video for this show tonight, said, what would I do if I didn't have any masks at all? And I thought, you got to have something. If you're the parent and you have to go, like you're saying, you have to go to the grocery store, you have to go to the pharmacy. Hopefully they're all open. By the way, everyone try to get at least a 30. If you can ask for a 90-day supply of your medication, that would be preferential. Joe and I just picked up 90 days of the prescription. A lot of the pharmacists encourage it. A lot of the medical and health insurance actually encourage you to get 90-day supply because it somehow costs them less. They even have home deliveries for it. But this is what I made to have some kind of protection. Is I took a sheet and I actually cut a rectangle. This is about 15 inches long. and I measured one ear and I cut a 3-inch hole here. And then I measured the other ear and then I cut that hole. I just folded this in half and just cut a half circle here. And I'll show that to you in a second. And then what I did was I curled up the sides so it would be tighter under the chin. So I have like a little cup here underneath there on the sides of the chin. You can see that fold right there. And then I thought, well, I need a nose guard. So I just grabbed some aluminum foil and I started folding it up and folding it up about that long. And I thought, well, this is probably good for a nose piece. Although I will tell you the next time I do this, I'm going to do a lot more foil. And then I just duct taped it. So I can actually put a little bit of a bend there.
About 1.5 inches of foil, right?
I do more.
Or
I do
2
more folds.
2 inches thick.
And then I would
I mean, not thick. I mean, long, wide here,
I would tighten this up a little
so
more.
you can breathe. Right.
And just make this tight and then pinch this. Now, that's just one layer of protection. So what I would do, and if I had my sewing machine going, I would have made a pocket with another piece of material right here and sewn it on 3 sides so that I could put additional layers in here. So what did I think about putting in here? I looked at my air conditioning filter. That material might be good. HEPA filters, be careful. Some of them have fiberglass. I think if they're the woven glass ones, you'd have to know your material. That might be okay as long as it's in that pocket. So in other words, this material is not directly on your face. There is cotton between you and whatever you put in here. You can put more layers of the cotton. I also have some air conditioning filter. You know, I don't probably want to sit here and breathe through it. I'm not sure what it's made of, but this does have 3 layers. And maybe I'll stick some of this in that pocket also. So, you know, do I know how much filtration I'm getting? I don't. But anything is better than nothing. And if I can layer this up and still breathe through it and make sure it's cupped underneath the chin here and folds to my nose and I have a decent fit, not a bad thing. And I just took a sheet and all I did was cut a rectangle. So we can all do that. We all have that. Doesn't have to be fancy schmancy.
But the key is not to have to go out, but sometimes you just have to. And so that's genius that you've put that together. I've never seen anyone, you know, actually do that. And of course you haven't tested it. We haven't, no one's tested it, but you said the magic word, it's better than nothing.
Right.
And you do want to wear goggles, correct? Because why do you
Absolutely.
Goggle? Yeah,
Absolutely.
absolutely.
That's my big thing is eye protection. It's not just your nose and your mouth. It is your eyes also. That's why I said, you know, whatever MacGyvered mask you want, you still want to have a face shield or goggles. Now, those can be snorkel goggles. What you don't want are the goggles that have a ton of holes. There's some of them that look like somebody just stabbed it with a fork over and over and over. And there's like 1,000 holes on both sides. There's some with indirect vents. Let me see do you have the goggle?
Yeah, indirect vent, yes.
Indirect vent. Okay, that's what this is. You see this right here? This is what you're seeing. Everyone who's dressed up in these biohazards, if they don't have those full face respirators on, they either have this mask of a different brand or a face shield. They've got one of the two because you can get sick through your eyes just as easily as through your nose and mouth. And maybe more easily. There's a theory that, you know, when viruses land on our eyes, they're absorbed and put into our sinuses quicker.
Right. They go
They
down
have less protection than we do in our nose and our mouth. So
right. They go down into the tear duct and the tear duct empties into the nasal cavity.
right.
Also, chemical splash goggles are one that you can look for. Also, swimming goggles.
Yeah,
But get the
that's what I
bigger
said.
one.
Snorkeling goggles. That's what I
Snorkeling.
said.
Don't get the small ones because they're too close to the eye. When you take it off, you could get contaminants in your eye. But go ahead and get a whole big mask that covers your face, right?
Yes,
Yes, that'd
exactly.
be great.
And you can look
Exactly.
cool.
It's a good idea.
Right. And being in Florida, or anyone who's coastal probably just has those snorkeling masks, at their house. We just have them. People in the, inner parts of the world or of this country may not. So what can you do if you can't get goggles and you can't get a face shield? I've seen people using 2-liter bottles of Pepsi or soda or something and splitting them open, and then you can put a piece of foam across your forehead. You can duct tape that foam on, and you want to do that because it's gonna hurt.
When you say splitting, we're talking vertically.
Right, just like that, and just open it up. And what you have, let me have the face shield. If you open that up, you're gonna have this like that, half circle. Right. And then you just need some sort of material. Even this actual air conditioning material right here, you could see might be okay to use as a strip there, just so you have something that's sealed and up across your forehead to protect any particles from coming in that way also. But you can make these.
One more question before we go to Charlie. So get ready, Charlie. So the whole idea is protecting anything that can have a way into your body. But also, what's the biggest danger of all? I mean, how many times a day do they say we touch our face with our hands?
Oh boy. Well, that's the thing. And just think about all of the things that other people have touched that you wind up touching. You go to the supermarket and you decide that you want to get an orange. You pick up an orange, you don't like that one, you pick up another one until you find the one that you like. Well, a stock boy actually put that orange up on that shelf. You take that orange and you give it to the cashier. The cashier holds it, weighs it, or does whatever she does with it, but she holds it. And then it goes to somebody that might be bagging the groceries. So you have to realize that there are just so many people that are touching items that you wind up touching, and then you wind up touching your face. Yep. And people do it all the time. If you ever doubt that, just pick one person and look at them for about 15 minutes and then see how many times you touch your face.
Yeah. So wash your hands as well. And so washing your hands, does the alcohol work?
Well, soap and water is actually, the CDC prefers soap and water to anything else. And I believe that when your hands are visibly dirty, absolutely, it should be soap and water. Otherwise, I think that you can use soap and water, or you can use alcohol-based hand sanitizer, but you cannot use it like this. Okay, I'm going to wash my hands. There's a drop, and I'm going to wash my hands with it. Nope, you got to use a bunch of it.
Here he goes.
There you go. See that? And you got to...
Give me my phone back before you ruin it.
You have to go all the way down to the wrist. You have to really, do a good washing with it.
Call it a soaking.
Saturation of
you go.
Of your hands. So that's the way you use hand sanitizer.
And your hands are like soaking wet while you're doing this.
Right.
That's
right.
I'm going to shock some people because I want some of you guys. Some of the things been posted on PrepperNet. It's going to shock you guys, and I'm going to tell you about them. You can go and look at them. But there are actually people in China that are going to elevators and they're licking their hands and putting their saliva all over the buttons on the elevator. They're going into stores and licking products. Have y'all seen this, Joe? They're licking products.
Yeah, no. I saw some guy got in trouble from doing it last summer.
And he's putting it back on the shelf.
Yes.
And then I saw a guy,
ice cream container.
He would spit in his hands and throw it on people.
My gosh.
When they walk by. There's some people that are nuts. If that happens in America, oh my, I couldn't imagine. Who would do that? So anyway, let's go over to Charlie. Charlie, you ready for, give me pie. Give me pie into the 20s. No, I'm kidding.
Sure. How many places?
So Charlie, you've thought through this entire thing before because you have a book on pandemics. And so to write a book, you've got to, one, in the prepping world, if you write something that is not feasible, you hear about it. So you've got to think through these things. And with your experience of being in certs and everything, what do you see like if a city or a town let's say a small town, like 50, 75,000 people, and all of a sudden 20 people have it. What's going to happen? What's the government going to do at that point? And what's that city going to be like? I mean, even in the schools and the businesses and the transportation, all that.
Well, so one of the the things that we've learned from various disasters and outbreaks and things like that is that if something happens to the local population, there's going to be most likely a surge event at whatever the local medical facility is. So people, somebody gets sick or it ends up on the news, and then a lot of other people think, well, maybe I have it, maybe I should go to the hospital or to the doctor, and a lot of people start showing up, and then they cause a surge problem at a medical facility. You've seen it in a lot of movies where it's exaggerated quite a bit, but medical facilities do need to plan for surge operations. And if you've watched any of the other briefings going on in the news these days, you'll see that that's true, that that they are making announcements of how they're going to handle things. There's been a lot of crosstalk about medical supplies, how they're going to deal with their supplies, where they're going to resupply and so forth. And I know Joe touched on a bunch of that. But once you get beyond the initial part like that, we might see some confusion by the authorities because they're not prepared because of the cross lines of communication, lines of authority that need to be addressed. You got a lot of people that do a lot of things, but they've not done a lot of these things in practice all the time. So that's a problem with emergency management, where everybody, they're really good at a lot of stuff, but there's going to be a learning curve with everything that happens. So it just takes a little bit to get everybody on board. So the more well-equipped and well-trained urban areas are probably going to be a little quicker to respond because they do it every day on a more frequent basis, whereas some of the rural places are not used to that. So you might have some conflicting messaging from different agencies. And you do see that in the news these days, where one agency will come out and say, okay, well, everything is fine. And, an hour later, another agency comes out and says, okay, well, we need to prepare to shut down all the schools and, in several counties or something like that. And that mixed message from the public information officer can really confuse a community. So that's improved a lot with the incident command system and the pandemic planning and NIMS and all of those different strategies that we're using. But it's, people are human, and that could be worse also if the responders don't show up for work because they themselves have become ill. So you might also see it extend into some panic buying, maybe some price gouging. I'm from South Florida, just like Joe and Amy down there. We've experienced a lot of that in the past. So try to buy a piece of plywood when a hurricane's bearing down on you. That is either going to run out, people are going to be gouging it for price, or you're going to be standing in a lot of lines. So that kind of stuff could be quite possible. You already see that with masks right now, some price gouging, some shortages on supply chains. If the infected patients get caught soon enough through either self-reporting, like they go down and say, oh, I feel sick, I want to get tested, then what they'll probably do is some tracking for who they've maybe been in contact with for the last however many days. They decide the screening process should be conducted. There's also the community screening. So if there's community screening, like you might get to the airport, if that gets picked up, that could be another issue. So when they look at how many cases pop up, if it's just one case, or like you just got a case out in Washington, I believe it was, that just came up and they have no idea where it came from. Well, that being the case, they got to figure out, okay, who did that person have contact with? If a whole bunch of cases pop up at the same time, the health department and the other agencies might try to decide if a containment operation is appropriate. So if it's not, they won't waste their time doing it, because it's kind of like putting your finger in a dike and you're not going to slow it down. So in that particular case, they might be able to do something called a cordon sanitaire, which I know I bumbled up. But what that just means is they're trying to restrict some travel, trying to keep communities kind of inside their own communities, not let people coming in and out that don't need to be there. So that could certainly help. But either way, they're going to push the public education and hygiene practices really hard. So without the cooperation, the buy-in of the public, which is going to be key for all of these things, it's very difficult to prevent that spread if you have something that is as infectious as, this seems like it's turning out to be. So especially when there's a long period where you have somebody that has showing no symptoms, but is contagious to everybody else. So,
Quick
but
question.
you won't hear the word quarantine by official sources usually, because Americans don't like that. It kind of panics people, and people like, well, I'm getting out of the city. I quarantine. I'm not going to be stuck in that. We've seen too many of those movies. So the word you're going to hear mostly would be containment or isolation.
So let me ask you a question.
Mhm.
So in China, I've seen, and I don't know if you guys know this, but I'm sure you got, I mean, some of you do. They've actually welded people inside their towers, their apartment buildings that are 15, 20 stories, because they know that the population in there, a vast majority of them had the coronavirus. So they welded the doors shut.
Mhm.
I mean, there's several videos of different places. Are they
Yeah.
going to be doing that in America?
I wouldn't think that would be the case. No,
Okay.
I don't think that, I don't think our people would really tolerate that kind of thing. Aside from that being a really bad hazard if you had to get in or out of that building in a hurry. I've seen those videos. You can search them out on Twitter, and you'll see all kinds of that crazy
Mhm.
stuff. So I don't see that kind of a problem. A lot right now, you're seeing a lot of people being asked to self isolate. So if they were at risk, or they've been as part of the patient tracing of somebody that had already been infected, they'll say, okay, we'd like for you to self isolate. And if the person doesn't want to self isolate, well, then the authorities might take that person into custody and put them in a box somewhere. But um, I don't think you're going to see anybody welding any doors shut around here. It didn't work that way over here.
Now, that's an interesting question, if you don't mind me asking. Not sure. Hopefully, you'll know the answer.
Okay.
Does the government have the right to confine me until I'm better?
If you're a danger to society, and there's been an emergency declaration, they have a better opportunity to do what's best in the public interest.
Wow.
So I would not put that past them if they're going. I mean, I've seen the videos in China where they're throwing people into boxes and stuff. I don't think that's quite the way that would happen. But on the other hand, we haven't really had that kind of an exposure here. So we haven't had that kind of behavior yet. So it remains to be seen. That's why it is so important that that agencies put out information, be straightforward with everybody, and tell them what we're really facing, and try to achieve that public buy-in. If you don't have the buy-in, people will start to not listen, and you lose credibility, and things are going to go haywire.
Right. So one of the other questions I want to talk, because you wrote a book on, it's called Survival Groups, which are groups to get together during emergency to help each other out. And I mean, you're kind of the expert. One of the experts.
I hate that word, but we're all learning all the time.
But you're an expert at this, and putting groups together, helping them form, helping them work together. Is this a time that people need to start talking to their neighbors or their family and go, hey, if this hits, we need to make some plans? Is this the time? Have we got to that point yet? And then, and if they do, what's some of the things that they should maybe start talking with their family or neighbors or friends?
Yeah, absolutely. This is definitely the time. Your time to work your group is always. If you wait till the last minute to try to figure out how to work together, you're already running up against a lot of challenges that you could have smoothed out before. So any survival groups are really just relationships. It's about finding people you can trust, people that you can work with, people that will work with you. You understand their personalities in good times and bad, within and out of their comfort zones. So right now, if I'd say that if you look at how the infected areas around the world are operating, with supply chains breaking, food and medicine those are parts of the supply chains. People are panic buying. People, companies are idle. If people have to stay home from work and schools are closed, I mean, if you recall, I don't know if you heard the news, it just came out that all of Japan are shutting all of the schools down until April, like all of the schools for an entire country. So if that happened, and for those of us that have kids, what would you do for daycare? What would you do? Because if the public school closes, so do the private schools, so do the daycare systems. So it has a bit of a cascading effect on the economy and on the labor force. So a survival group is going to be helpful for you, and these are people that you should have already chosen to work with you, that you trust with your kids. And this is the exact reason for that. So let's say that now your company is shut down, or is allowing you to telework or telecommute from home or from a remote location. And you've got kids that are, for those of you that you have young kids, like I do, you can't get anything done when they're crawling all over you and they want something, they're bored. You got teenagers that are all over the place. It helps to have, now your group is together and you've got somebody that is able to take turns watching the kids, putting them through some homeschooling, getting them on the teleschooling or the internet schools that will be set up. I just saw South Carolina just did a briefing on that with talking about how are we going to get internet to kids that don't have computers and internet connections and things like that. So that's what your survival group should be doing. They should be supporting each other in a time just like this. And if you don't have that resource, then that's going to be a little bit harder for you to get your work done.
So a survival group, we call it survival group because to the layman or someone that's not considered a prepper, it could be family, friends, your neighbor. It's just your friend group, your tribe.
Absolutely.
Right.
It's whoever you trust to work with, and you don't still have to tell everybody all your secrets and how many years of food and how much ammo you got. It's just about, in some cases you can just kind of, drop little bits out and say, hey, how about we form our neighborhood up together? We've got a bunch of kids that we got to watch. Maybe you don't want to put all the kids in the same place, but kids are little petri dishes as it is. Right. Maybe you can put different groups out and work within those groups. We don't have any cross-contamination if something happens. So again, this all depends on your threat conditions. It depends on, how pervasive the infection is in your community. Is it there yet? Or is your community just trying to be proactive and shut everything down because there was a case or it's coming? So that's where your group should really be for you.
And there's elderly people, there's people within your community, your friends, family, that they need help. And if they might need to relocate to your house. I mean, if your mom and dad, have issues, health issues, and they can't get up and, they're just getting old, you might want to bring them to your house so you don't have to travel back and forth. Absolutely. Especially if there's travel restrictions. Mm-hmm. You don't want to get caught on the wrong side of that. You don't want to get out. There could be curfews issued. There's a wide array of responses that government agencies can do, communities can do. And don't underestimate the civilians within a community trying to protect their own communities. Right. So if you've seen some of the stuff coming out of China, early on, there was a lot of people that were building brick walls right on the middle of the roads coming into town because they didn't want anybody passing back and forth into their town. They had small villages with very little medical resource, very little help from anybody. So they were like, well, we're just gonna keep everybody out. And they weren't gonna become this self-contained type of unit. And I would not be surprised to see some neighborhoods, if it got to a more serious situation, I know we're reaching into the extremes here, right? But groups will shut down a neighborhood. And also, if you have kids and let's say that a city or a neighborhood or an area, 20 people all of a sudden get affected in this area, this neighborhood, and you and your family, you're good, is your family might drive you nuts if you're locked in your house for a couple of weeks. It might be good to partner with a couple other families that that are safe, just so that there's entertainment and there's, it's not doom and gloom, not doom and bloom, but doom and gloom. And so, yeah, there's many reasons. Also, it builds there, some of these people have been, when you're isolated, it's tough. We've never had that in America. Yeah, it's something that we don't normally experience around here. And we value our freedom of movement, and we have a different mindset than some of the other countries in the world. And
to sit, anybody that's got kids or been trapped in, cabin fever for a while, if somebody told you you couldn't come out of your house for 30, 60, 90 days or something like that, you would go nuts. And then you're starting to get appetite fatigue. You're getting on each other's nerves. You've got to find a way to take some of those stressors off and move around, get some exercise, get your nutrition. And that's why I say you've got to plan for this kind of thing. If you get caught unaware, I believe that when Wuhan came under lockdown, it was announced at 2 a.m. They had 8 hours. If it was already 2 a.m., the sun wasn't even coming up for hours yet. And then all of a sudden they were said, okay, you can't go out anymore. And if you have a society and a group of people that do not normally set aside food, and now you've been told that you're not coming out of the house, we can't tell you when you're going to be able to, and we're going to weld your door shut, you're going to start running into some serious humanitarian issues.
Yes.
So, and that's going to drive people crazy. And then, that's like the people that were on the Diamond Princess cruise ship. They weren't allowed to leave the ship. They couldn't disembark. And how many of them became infected because of the way the crew was moving food and stuff through the aisles and through the passageways of the ship. So a lot of people got sick even while they were being contained. So there's a right way to self-isolate or be contained, and then there's a wrong way. And we've seen a lot of the wrong way so far.
So we're going to come back in a minute to you about some of the things that maybe people could go buy and maybe they need, that not panic buying, but just smart strategic planning for in case something like that happens. But first I want to go to Dr. Bones and Nurse Amy. So we've clarified people need goggles, they need gloves, and they need a mask. Now, two questions in one, and then you can comment. One, can you reuse the mask time and time and time again? And two, is there a proper way to use the mask and gloves and goggles? Because there could be contaminants on them, and I'll let you guys run with that.
Now, with regards to whether you can reuse masks and goggles, believe it or not, the CDC has criteria for when you are allowed to have limited reuse and extended wear of goggles. And so basically, they realized that at one point or another in a prolonged pandemic situation that there's going to be, a limited supply of masks, for example, and that if whatever happens lasts long enough, well, you're going to run out of supplies. So you may need to extend that use. And so what they say is that if you're taking care of a number of sick people, let's say, half your family got sick and you got them all in the sick room, that, or they were actually talking about hospital wards, but I'm talking about an epidemic sick room. That, well, what they do then is they say that it's okay for you as long as those people are sick from the exact same thing, that the same bug has gotten to all of them, that you can indeed use the same mask to deal with different patients. Ordinarily, you actually change your mask as you go from patient to patient, because most of the time they've got different problems, different medical issues. Limited reuse of a mask is when you are seeing a patient, the same patient, and then you're always seeing that patient, and you take the mask off, and then you put the mask on again. And they say that even for a limited time, that you could actually even do that as long as you store it in a proper fashion. Now, they're a little vague about what the proper fashion would be, but I would think that it would be in some kind of containers so that, you're not winding up getting it wet, or, it would have to be some kind of dry setting, cool setting, I would guess, just like you store drugs.
But these masks will have contaminants on it, right? So
yes, the front of your mask is contaminated. So whatever you do, whenever you take off a mask, what you have to do is you have to make sure that you take it off by grabbing the very back end of it like this, and making sure when you take it off that you are not touching the mask itself. If you have plenty of masks, then this is a proper time to dispose of it. But if you can't do that, then basically what you would do is you would be able to store it. They don't give you an actual formula as to what to do, how to store it, but they just say it should be stored appropriately.
Mhm.
So what can I say with regards to that?
So
And what was the second part of that?
well, when you take off the goggles, I read that you have some Clorox in a bucket.
Oh yeah.
Yes.
And
Yes.
just
One
take your
part.
goggles. Don't touch anywhere you
Same thing.
Here we
Same
go.
idea.
Okay, here we go.
Only touch the
All right,
back.
look.
Over and
and then you drop it in a bucket of Clorox and water, right?
Front is contaminated.
Yes.
Throw it into one part. Yeah, just what you said.
10% bleach, 9
Okay.
parts water, 1 part bleach.
And your gloves, you just grab them by your teeth, right, and pull them off.
Yeah.
There are proper donning. Donning is putting on and doffing, taking off steps. Easy to find. World Health Organization has printed instructions. I think this is the putting on, and that's the taking off.
This is the
Okay.
taking off.
So you can't mess it up. They've got it.
Okay.
That's just taking off the gown.
So
The bottom line with gloves is that when you take them off, you either are taking them off along with your coveralls. As you remove the sleeves of the coverall, the
Mhm.
glove comes off with it because the glove is over the cuff. Or you would take it off by reaching inside and not touching the outside of the glove at all, reaching inside and remove the glove.
Okay, and so I
In-
do
in
want.
between every one of these steps that we just showed you of
You-
taking it off, you're either washing those gloves in your decontamination room or you're using hand sanitizer.
Okay.
Right.
Between every step of what we were showing you to take it off, it says
Perform hand hygiene.
perform hand hygiene.
Right.
Take the apron off, perform hand hygiene. Take the
And this is with your gloves on.
take the hood or the hood that's attached or the separate hood off, perform hand hygiene. So every single thing you're doing, you're performing hand hygiene to try and prevent recontamination of any part of your body that you did have covered.
So let's say you have a sick room and you've got 2 kids in there or an adult and a child. The reason you want to have a full suit, because a lot of people go, I'll just wear a mask and goggles and gloves. But the reason you want to wear a full suit is because them particles can get on your clothing, correct? And when you have a full suit, it protects all your clothing. So properly, I mean, you would have to wash your entire body and take your clothes off to be clean from that environment. So they have these Tyvek suits at Home Depot and Lowe's. They have them there, a ton of them. I went there just yesterday and they have them, and it covers your face. It covers all your clothes. It covers your shoes. And this isn't crazy conspiracy theory. That is to protect the current clothes you have on and your skin, because this virus can live for 9 days. Is that still correct?
That still is thought to be the amount of time that it could possibly be, which is an extraordinarily long time for a virus to live on a
So
surface.
it could be on your shirt, a molecule, and you touch it 3 days later, and you can get and then you rub your eyes, you can get this. So the Tyvek suits are to protect you from all particles, air particles. And there's a proper procedure of putting the mask on and taking it off, putting the goggles on, taking them off. That's why you don't want to wear little swim goggles, because it's very close to the eyes. You want something bigger to keep it further from your eyes. And
I just want to say that.
Go ahead.
I've had quite a run on people buying our antibiotics and infectious disease book. I just want to tell people this is about available antibiotics. It's my book on fish antibiotics and how to use them to cure bacterial illness, not viral illness, which is what we're dealing with here.
Right.
However, in the back of my book, I have indeed, let's see where it
I
is.
saw that.
The supply list.
I have not the supply list, but what I'm looking
How to put on your suit and how to take off your suit.
right.
Yes, pictures.
And so
Yeah.
I have, specific
Good.
pictures,
Yeah, he showed it too.
Oh, he
Yep.
showed.
No, you got it.
Okay, well, that's good. But what I'm saying is I have almost like a time-lapse photography on what I'm doing to deal with the various issues of taking it on and putting them on and taking them off. Now, the thing is that you're supposed to always have an observer in in hospital settings, there's an observer when you are, especially when you're taking them off, when you're putting them on, but when you're taking them off, definitely, because a lot of people accidentally will contaminate themselves, or maybe if they're lax about infectious control, disease control, well, they may not do a good job of taking off their contaminated equipment. That's probably what happened with when those 2 nurses in Dallas got infected from that Liberian national that came to the United States with Ebola and then died. So that's the thing. Now, I do want to say one thing. I have the interim guidance for home care from of people not requiring hospitalization for coronavirus. This is from the CDC, and they actually say that at a minimum, you should have gloves and a face mask. They don't say specifically that you must have a coverall, but with a disease with this kind of contagiousness and infectivity, then and with a death rate, that you really need to have a coverall. And also, they don't even mention a face mask. So from my end, this CDC is in this. There you go. This CDC guideline is actually inferior to what common sense would dictate.
Right. Okay. Okay. We're gonna go to the dark place now.
No.
Okay. I'm gonna go over to Charlie. Since we're talking about dark stuff. You ready, Charlie? Okay.
Yeah.
You got your family, you've got your people, you go, okay, guys, if this is going to go down, we're going to go through this together. So let's do some planning. So what kind of things would a group of, like, let's say 3 families, 4 families come together, big house on the lake or whatever. What kind of things would they need to maybe get through an extended quarantine or containment area, self-containment area or quarantine area, whatever. What kind of things should they go out and buy? I mean, everyone don't go buy all this stuff tomorrow, but this is just common sense stuff to have. But go, what?
Well, all right. So to make it easy for every situation, whether you are packing a bag, like a bug out bag, a get home bag, or if you're putting your supplies aside at your retreat, at your home, where anything that you're preparing for in the survival related business, if you will, I came up with a list of 9 things. Okay. So if you just remember the 9 things and say, okay, do I have something within each of these 9 areas covered? I'm good to go. And then once you do that, then make sure now you've scaled all those evenly. So when I say food, I don't mean, okay, I got a bag of chips and I've got 10,000 rounds of ammo. That's not going to help you so much. So I want you to think about food, water, shelter, safety and health, security, energy, communication, transportation, and intelligence gathering. If you take those 9 areas and just go to your head and say, okay, did I get something from all of these? If I did, I'm pretty good. Now, how long, what's the duration, and how many people am I going to be responsible for? So my short answer to really all that is, I like to say, what would you need if you had to stay home for, say, 3 months? That would be like food, water, medicine, medical supplies, pet food. Who am I responsible for, and what kind of stuff should I have to support that, so that I wouldn't have to go out and buy something or try to scavenge or acquire it somewhere else later on. So worst case, if you had 3 months worth of food, I like more, but at least start there if you can. And the worst case is, in the future, if you don't eat that stuff, you won't have to go to the store for a little while. You're not going to keep, like fresh broccoli and celery and lettuce and all that stuff, good. But if you had the freeze-dried version, like a Thrive food or something like that, that stuff will last for many, many years. And it's just as good as fresh food because it doesn't have all that other stuff in it. So that's a good option for food storage. So that's my approach. If somebody asks me, what should I do? So think about what if a pandemic changed into something else and it started to reverberate and go back through in waves through a community, it might go and come back again. So the gentleman that flew from China to Iran, then got back on a plane and went back to China again, is now, he can risk restarting another wave of infections and that I think happened, Joe, correct me if I'm wrong, that just happened in the last day or so. So that kind of thing is important. So think about the people that won't show up to work. Think about the stuff that you would want to have on hand. Do you have enough food? Do you have enough water? Do you have things that you need specifically for your family? Durable medical goods? Do you need oxygen bottles, for, medical equipment? Do you need whatever it is for wherever you are going? And then plan from there. Think about your contingencies. This is what we do. This is what we consult on, is blind spots and gaps in your plans. Put a plan together, start working that plan, try to identify those gaps and blind spots. Where am I on that? Try to sit down and say, okay, do I have enough for everybody that's going to show up at this location? How many people in the family? Do I have kids stuff? Do I need diapers? Do I need baby wipes? Do I need, butt cream for the baby? Do I need gripe water or whatever, that my baby might need? Formula. Do I have a way to purify water so that I can make baby formula? Because I might run out of water bottles. So start to think through your plan and say, okay, if I had to stay somewhere for 3 months, what would I need? And that's where I'd start.
And I think you start with, a lot of people, we say double, triple, quadruple your pantry. Food you already eat. Mm-hmm. And for truly right now, the freeze-dried food market is really kind of locked up because they're so busy that they can't get the orders out. I mean, and so just go to the store. The next time you go, buy double what you usually buy, triple what you usually buy. And the people coming over, tell them to do the same thing. And then all of a sudden in 3 weeks or 4 weeks, you will have a month, 2 months worth of food, of just normal food. And guess what? If nothing goes down, you just don't have to go to the grocery store again, like you said, for a while.
And the benefit to setting food aside is, other than buying it today at a lower price, because it might go up in the future in cost. So when you do get around to eating it later, it's like eating it at a discount. But the other side of that is, if I've got extra food and my job is now shut down because of this situation, now I don't have to take the little bit of money that I might have in the future and spend it on food. I can now spend it on my health insurance, my mortgage, my car payment, whatever those important things are that I can't live without either, because I've already got my little grocery store set aside at home. So right. You're actually saving money that way. You're saving trips. You're not doing the impulse buying. The whole food storage thing has a lot of benefits. And this is
right. And so I'm going to throw a little spiritual note in here. The Bible says that if a man can't provide for his family, he's worse than the unbeliever. And so we're all, moms and dads, we got to take care of our kids. Even if we lose a job, we still have to have food. And so why not? You buy insurance for your car and hope you never get in a wreck. You buy insurance for your house, you hope it never burns down. Well, buy insurance for living by getting some food and storing some water. It just makes good sense. The government says, for last year, they have the ready, whatever it's called. They have their little thing, 3 days. And now they've extended it over the last, recently, before this is all hitting us. But you're correct. You want food, water, you want pet supplies, your medicines. Go and get your medicines, prescriptions months in advance, also, but I also want to go to Dr. Bones and Nurse Amy over here, because there's some medical supplies that you should have on hand in case you do get sick, or maybe help prevent this. I don't know if a Tamiflu would work here or not, but let's say that what medicines would be good for someone to have on hand in case you're locked in or whatever the case.
Well, the medicines that you would need in this kind of situation, since we don't have a cure, and Tamiflu has not been shown to be effective in normal doses, at least with this particular virus, although it is very effective in a lot of cases of influenza. Well, you want to have fever reducers, things like Tylenol or Advil. You'd want to have pain relief. Same medicines probably would be good for that. Most people don't have a lot of pain though with this, and also ordinarily I would say decongestants, but then I'm talking about influenza really as well, since this does not really show that much in terms of nasal congestion. But if they do have those symptoms, those are what you would do. About 5% of people wind up having diarrhea who have COVID-19. So maybe an anti-diarrheal in some situations. And certainly the most important thing is to rehydrate and make sure these people are well hydrated. They've got a fever, they're going to be sweating, they're going to be losing fluid. So you have to make sure you keep these people hydrated. And during the Ebola epidemic in 2014, the death rate from Ebola went from 60 down to 40 something, just simply because the World Health Organization was able to bring a significant amount of intravenous fluids into the country and IV sets and things like that. So that's something that's very important. You should have oral rehydration solutions, try oral, something like that. Or you can make your own 6 to 8 teaspoons of sugar, 1/2 maybe of salt, maybe a quarter of salt substitute for some potassium, and a pinch of bicarbonate is also useful as well. So that would be a good adult rehydration formula.
How about like things like Mucinex or anything?
Mucinex would be good too if they're dealing with. The thing is that COVID-19 gives a dry cough.
Okay.
So it's not such a productive cough. Now, of course, Mucinex may help in people who do have a lot of mucus coming out or a lot of phlegm coming out. If you were really sick from COVID-19, you can actually cough up blood, but I'm not sure about whether Mucinex really does much at that point. I mean, you really need some intensive care respiratory support at that point.
Okay.
And by the way, cough suppressants in general, you should only use them if you are having trouble sleeping. If it's not allowing you to get, your cough is not allowing you to get rest, then use a cough suppressant, otherwise don't.
Any other medical or like, oh, here's one that I've just read the other day. A lot in our family, we have the thermometer that you put in your mouth. Mm-hmm. And we don't have one per person. We kind of have one for the whole family. So I sent my wife out, or I asked her when she was going out to get one that either, you know, reads it without touching someone, or the one that you just lightly touch on someone's forehead, because you can clean that off pretty good with a wipe. But you don't want the old style in your mouth, or because you don't want the possibility of affect, you know, someone else getting it through the transfer. Correct?
Well, that's true. Although remember, you could use alcohol to, you know, to kill that virus with, and so if that's what you got, I think I would use it as long as you disinfect it between uses. Of course, if you can get a hold of the new technology, of course, that would be, I think, even better.
So you didn't tell us you had to get alcohol. So we do have to buy Clorox, right?
Well, there are a lot of things out here. I'll tell you what you need to get. Okay, pandemic items, I separate them out in the things that you should need to wear and things you need to use. So you talked about the coveralls. It'd be great if it has a head cover. If not, you need one of those separate hoods that comes along. Many times they come with booties. If they don't come with booties, then you want to have, and you probably, even if it comes with booties, you probably want to have a rubber boot like this.
That's your disco boots. Come on.
Yeah, disco. Right. Haven't used them since the 70s. Yeah. And of course, you mentioned masks. We mentioned goggles. You mentioned gloves. Now, a good thing about gloves is you don't have to use sterile gloves. Remember, you're going into an infected environment, so that it's nothing sterile there. Aprons are very useful. The sort of coverall extenders, if you think about it. Of course, lots of hand sanitizer, a basin with soap and water, and a table that you can have right outside of the room, so people, before they come in, they can wash their hands. After they come out, they can wash their hands with soap and water. Maybe some hazardous waste bags, tissues. You want to have, when you're cleaning with the chlorine solution, you want to use paper towels if they're available, and you want them people not to use handkerchiefs. You want them to use tissues. You want to have stuff paper products that you can safely dispose of instead of having to deal with trying to clean them. And wash them in the same laundry with the healthy people's. Let's see what else. The other thing last thing I would do is I'd have a noisemaker, a whistle or something like that, that would let the sick person or sick people let the medic know if that person is not in the room that they need help. So this gives them a little confidence that a bell would do just as well.
Yeah.
Yeah.
Or iPhone. So a question, Clorox doesn't go bad, but it loses strength over time. Is that not correct?
Yes, that's true. It probably would last maybe 6 months to a year, as potent enough to really do a lot of benefit. There are a lot of solid chlorine products. Some people have mentioned Pool Shock. There are other things that are not calcium hypochlorite that you can use as well, that are granules that are used to make bleach, and then not bleach, chlorine solution.
Mhm.
And then you use a little bit of that to disinfect water or to put in your cleaning solution.
So you might want to get some Clorox if you've had some around your laundry room for a year. Get some, that because it does lose a little of the some of the strength. Also, women's hygiene products as well. You're going to need a supply of them. Where's Amy to talk about this?
Yeah, Amy, believe it or not, Amy cannot resist a call from her daughter, so she's out just for a few minutes.
Okay.
So her daughter lives in Chicago, so she doesn't get to connect.
But so the women products, we'll say.
Yes, well, I mean, you need basically, but not only that, you need bedding that's going to be dedicated to the patient. You're going to need eating utensils and plates that are going to be dedicated to the patient. So you want to have as much of the items that they use be only for the contagious people and not being used for other people. And
Right.
so you should wash all these things separately from other people's, the healthy people's items. And you basically, you're putting together a little isolation unit in your home is what you're doing.
Okay, we'll come back. Hey, Charlie, wake up over there. I got a question for you.
I'm just playing in the chat room. Go ahead.
Okay, so our community has a breakout and we're waiting for FEMA to come save us all and to bring in the food and the water and to bring us the N95 mask to kind of come and take care of us. Is that the way it's going to go down?
No. So generally, no. Remember that FEMA is a logistics coordination agency. I know they get a bad rap for a lot of things, and well, that's the political side of it. But what FEMA does is they deploy teams to disaster zones. The teams will then figure out what the local communities need, and keep in mind that all disasters, no matter what they are local. At the end of the day, it's really affecting who's on the ground right there until anybody else can show up. So the teams will then figure out what assets are needed in that community, and then they will work through their planning arrangements and production to find things. So if you need a bulldozer, a fire truck, aircraft, you need more manpower, they would do that. But that usually comes from hurricanes, earthquakes, tornadoes, things when the local agencies might be overwhelmed or collapsed or lack of assets, or they've just been called in, for assistance. Because there's a lot of policy that has to happen before FEMA they don't just show up in their trucks and blue jackets and start taking over without being asked generally.
And
so
go ahead, keep going.
Yeah, things have to be really bad for them to appear. They usually, like I said, they got to get called in, and they're not there to take over. They are a logistics coordinating agency. They show up with laptop computers and trucks, and all they do is they find assets that are needed for the community, and then they find a way to get them there. There's an entire reporting thing. A lot of communities try not to call for that kind of assistance because there's so much paperwork involved. There's a lot of billing. It has to go back and forth when this is all done. I worked with the agencies down in South Florida. Hurricane Andrew hit in 1992. It took 22 years to finish the last piece of paper on that. I met the guy who had just finished it, and he was like, it's been 22 years trying to close this thing out. So yeah, it's not the first choice.
Yeah, I remember blue tarps for years.
For years, especially where you guys are.
Yeah.
Yeah. And trees, took forever for the trees to grow back.
So let me ask you this, Charlie. In your book, The Pandemic, and I know it's just the first series, how bad does it get in your book? Did you see in your mind?
So, all right. So if there was a fun part of this, it would be writing the fiction. I enjoyed the fiction writing. So when I came up with the idea for the virus that unravels the society, that's why it's called The Unraveling, I wanted to be as hot and contagious as possible before symptoms appeared. So then after 16 days, spoiler alert, people either die or they begin to recover. That was designed specifically, that disease was designed to hide in the shadows of the seasonal flu. Just so, because I wanted to get
I like this one.
Well, there you go. That's the thing, is this one kind of had rivaled it a little bit. It's not my fault. I didn't design this. I don't care what the internet says. So, but you know, I don't see the unraveling of society. I don't think, unless there was a major mutation. Joe might be able to comment on that. Who knows? But like I said, I'm not calling Matt Damon for a part 2 of his movie Contagion.
Okay, yes. I watched that with my 16-year-old daughter. Don't do that. Matter of fact,
don't do that.
After I read this book, I think my first text to you was, "I hate you" or something.
Yeah, you did. Yeah, and you would wash your hands a lot.
I would wash my hands like I would even. I'm like, I haven't washed my hands in 15 minutes. I need to go wash my hands.
Yeah. Yep. Yeah.
A wise move.
Yeah. So, but yeah, that book really made me mad. And the book 2 is coming out soon, correct?
Yeah, book 2. We're doing the cover art. It's written. It's, I took over doing magazine stuff, and now I don't have time for all the other stuff I want to do. Okay.
Dr. Bones, real quick. We've been doing this for a while, but this is good information. This information that we're giving some people, I mean, it's the first they've heard of it. So if someone does get sick, there is a sick room, and quickly, if you don't mind, just go through what a sick room is and how do you treat it? What do you do? How can you quarantine or, contain someone in your own home and take care of them? Because it could get to a point like in China, the healthcare system was about to crash at one point. They had over 3,000 people in the healthcare system that had the virus. And if it happens in let's say it blows up in Charlotte, the hospital's not going to be able to hold everyone, and not everyone needs to go to the hospital unless they have some things get bad. But so how could someone take care of a family member while they're at the house?
Well, I think that the important thing is that you assess whether you're able to put together a sick room or not. A sick room is a place where you keep people that are infected with a contagious disease away from the healthy people. So everyone needs to look at their home, look at their apartment or retreat. I don't want to go to your house tomorrow and see it all laid out like a intensive care unit, but I want you to start thinking about this, that there's a place somewhere away from common areas, away from where food is being prepared, away from where there's the most traffic in the house, where there's a door, a barrier, maybe, or if not, the place some plastic sheeting to make a barrier that would be able to house people that are sick and keep them away from the healthy people. And it should be well lit, it should be well ventilated. That's something important. Although air conditioning ducts actually should be taped, because you don't want viral particles that are airborne to go to the rest of the house. So, but something with a window, so you have good light, and you have also some good ventilation. I would say that if you're bugging out, you want to bring an extra tent with you that's going to serve as the hospital tent. You have to realize that if you don't plan these things out now, let's say you have a group of people that are going to converge to a certain place. If you want everybody comes bringing exactly one tent, and then you start having people getting sick, well, you're going to need a tent for that person. And so that means you're going to take somebody's living space away from them, and that's going to cause a lot of resentment and disharmony within a group. And Charlie would know much more about that. But honestly, the CDC actually is approving of home care for people that have mild cases. They say that as long as the patient is stable enough to receive care at home, that there are caregivers available, that there's a separate bedroom where the patient can recover without sharing immediate space with others, resource and access to food and other necessities are available. The medic has enough personal protection equipment, and people that aren't really sick, in other words, that is, I guess, basically the rest of this is, in other words, if somebody is turning blue on you, that person should go to the hospital. It is not a home care. So that's the thing, people who are showing after about a week, they're going to show whether they're going to get better or whether they're going to be one of the critical patients. And if that's the case, then they need to go to the hospital. The hospitals are going to be overcrowded and understaffed because indeed, probably thousands of medical personnel will probably be infected with the virus as well. But it may be the only place that has respirators or any kind of chance to give any intensive care respiratory support.
Awesome. Do we know the real numbers of people that actually get it and get better? Do we know? Did you mention that kind of stuff in the beginning?
I have that actually. I think I have that.
What's the death rate, I guess, is the question here.
Right. The death rate for this is, well, you got 83,379 cases, 2,858 deaths. That's actually hits about 3%. They have been quoting 2%. And there are a couple of things that are possible. It's possible that the governments that are not transparent may be hiding people that have died, or it's very possible that so many people have chosen not to go to crowded, overcrowded, and understaffed hospitals that there are hundreds of thousands of cases out there and the death rate is actually much lower.
Yes.
So it's hard to really state what, for example, in Iran, which is somehow everybody else has a 2 to 3% death rate and Iran has a 15% death rate. It's probably because they're not counting right. Maybe they don't have the test that's available. Maybe they just don't want to instill panic in their people, or they're just in general not the type of government that gives out information about anything negative that happens in the country. So it's I think Iran has probably tens of thousands of cases right now, not 200 and something, as we mentioned earlier in the show.
So is there any last words, Charlie? What are your last words, Charlie?
Wow. Is that where we are?
No, I mean,
let us cross the river.
Yeah.
Oh,
sit under the trees.
Yeah. So is this something, I mean, I was hoping that people would get educated on things that they could do or learn what they could do and not fear this as much as they have been, by getting them practical things that they can do and know that this is, I hate saying this, it's like the flu, maybe a little worse. You might get it, but your odds are pretty good you're going to survive. Yes,
indeed. The odds are good that you're going to survive. It's a little worse than the flu in that a higher percentage of people actually do get pretty sick, but the grand majority of people are going to survive. The death rate is, as I said,
I'll be honest. I think their numbers are skewed a little bit because they don't have the healthcare system like we have over here.
That's true. Well, that there are probably thousands of tests that are in this pile at a lab somewhere that just haven't been done. So we don't know whether, I don't think the people who have even had tests done necessarily know whether they're positive or negative.
But they don't test
unless they have symptoms, right? And they may not test, they may not test certain people at all. And they certainly have a limited ability to do so. Even we only have the ability right now because of questions about our tests' effectiveness, because people are turning positive, then negative, then positive again.
Well, I
But there
listened
are
to
other
a
reasons
doctor
why that
today
could happen.
that was saying that it's possible to use a CT scan of the lungs to determine if it's this, because
Well, it has
apparently
you're right, Charlie, in that it has a certain look to it when you have it, that
if you know how to interpret the look.
and right, exactly. And so indeed, China did include people with X-ray findings that look suspicious in their count one week, and one day they wound up having 15,000 cases in one day. And that's after several days in a row, which they were counting just 3,000. So the way you count cases is different probably in every country. And I don't know which way is the most accurate, but I think there's a lot we just don't know about this virus, and we're just learning about it now.
Very true.
The hard way.
Yep. So Charlie,
Mhm.
with all your vast knowledge and your big brain,
Your brain.
Your
Your
big
brain's so
brain.
big.
yeah, and all the emergency situations you've done, the groups you consulted with, everything that you've done, knowing a little bit about this virus, give us some last thoughts instead of last words.
All right. So I would just say, just up your situational awareness. I would tell my clients to start paying attention, get your group and families to start leaning forward on this. We don't need to panic, but I would say, forget about all this stuff, because people are going to say, oh, the flu is worse. We've heard that on the news. And well, Joe can attest to, how the case fatality rate might be higher in this, but learn the facts, set up your information gathering, shore up wherever you are, or wherever you're weak on supplies and skills, because this is one of those things that we prepare for. So if we spend all this time preparing and training and nothing ever happens, well, here's now something that can happen. So all of the things that you've been doing for all these months, years, and everything, or if you're just now getting started, this is the time to put those plans into action, to find out where you're coming up short, where you're strong. Do your after action report, communicate with everybody else that's on your team and your family and your group, and say, okay, what could we have done better? What can we do better? Do we have a place to go? Pay attention to everything that's going on around you. I pay so much attention that it all does blur together sometimes. I had to step away from it because there's so many sources of information coming and going, and you don't even know what's right or wrong. So now we have to back up and say, okay, what's going on? At the end of the day, we have a disruption event. Let's just do what we've always planned to do and survive. And remember, at the end of the day, all survival is physiological first. If you can handle that, you can stay fed, warm, above room temperature, then you're well above everybody else that's around you. So that's my recommendation.
And also, I want to say, add to that is, this past weekend I went to church, and okay, I know there's new people here, and you thought all your life these preppers are a little nuts and crazy, but all of a sudden now you're watching our channel.
Yeah. People aren't laughing that I bought masks a little while back.
Exactly. They're not laughing now, but they laughed when I told them. So I went to church this weekend, and I counted 13 people came up to me, because a lot of them know what I do. It's kind of a little small mega church, I guess. They'll come out to me and go, hey, come over here. Hey, what do I need to do for my family? And all of a sudden, I'm one of the smartest guys in the church, which actually I've never been accused of that. So this is a good thing, I guess. But they're asking. So if you're a prepper, share the information freely, please do. Mm-hmm. And if you are someone that's just learning, there's a lot of misinformation out there. Charlie, the people that we're interviewing that's on our show list, these are people that know what they're doing. I trust them. I've known them for years. I didn't go get a bunch of ragtag people to help me kind of form this and advise me. These are experts in the world. I'm telling you, if I had this group and we had to bug out, with some of Jonathan Hollerman's skills, Dr. Bone, we could take over Russia, right? Okay, maybe not Russia. Okay, Italy.
Yeah.
Okay, maybe okay.
Okay.
But these
Let's
people
pick someplace that doesn't have an outbreak right now.
Yeah, can
okay,
you pick
yeah.
something a little bit more hospitable?
Okay, how about Fiji? I don't know.
Yes, there you go.
But these people have the knowledge, and they thought through this. They have the experience. But Charlie, in a minute, well, I'll do that right now. I'm gonna go to a slide here. This is Charlie's info. So Charlie, if you don't mind, it should be on the screen there.
Yep.
There's your information. Tell us one last time what you're doing, when your next book's coming out, what's Survival Dispatch, what's the Insider. Give us all the numbers and digits on
All
that.
right, I'll give you the quick story so we don't keep anybody up late. I'm the chief editor-in-chief for Survival Dispatch Insider magazine, which, by the way, in December we did an issue called Germ Warfare, which Joe wrote several of the articles on how to do the isolation room, and all that stuff is in there. So if you want to go to insider.survivaldispatch.com and check it out, amazing magazine, zero advertising in the magazine. We're pushing anywhere from 60 to 100 pages of highly polished graphics with no advertising, with a lot of different writers, with a lot of different perspectives on one topic per month. So you can set it aside. You can say, wow, it's everything I need right there on germs. I also run readygoprep.com, where we do consulting and assessments, security planning, and like I said, everything with drones, all kinds of stuff there. And you can find my survival group handbook, the Unraveling book, or Prepper Survival Retreats on Amazon. They're all there. You can just search my name and the books will all come up. Book 2 of the Unraveling Bound to Survive series is, like I said, done. It's in cover art. I just got to finish up a couple of little edits, get the cover on it. We're going to drop that thing out and get it out to everybody who's been patiently waiting and yelling at me to get it up there. So thank you so much for everybody for listening to me and reading my books, and in our magazine at Survival Dispatch Insider and Big Daddy Unlimited, the affiliate site, to get wholesale prices on everything from guns to ammo to high-end gear, you name it. Big Daddy Unlimited, amazing resource. You can save $100 to $500 per firearm by going through that, because we are a big firearms distributor. It's a major site, 200,000 SKUs of parts and weapons and equipment. So check that out too.
I do have to say, guys, the survival, it was called MAGS, and then he changed the book to Survival Group Handbook. It is a how-to book to put together a group. It is the how-to book. It's the best book out there. So I've read that at least 10 times in my life, and I actually have several copies, and I just can't find them. I think I've given them out to people. So then he did this fiction book, and I'm like, okay, it's not going to be that good. I mean, you can't go from nonfiction to fiction. But I'm telling you, I read that book in one day. You know that, right?
Yeah.
I read that book in one day. I listened to it. I did do that. My wife said that's not the same. I say that's BS. Come on. But I listened to it in one day, and it was excellent. It was excellent. I do have to tell you, it scared the poop out of me.
It was a bunch of everyday people that got thrown into this kind of a situation, and things started to deteriorate, and the game is afoot from there.
Okay, let me say this. The reason why would you read this book is because it lets you think through situations that the characters are going through in real world, in their little world. He builds the characters, and these people sometimes have to make choices, and then they see things, and it makes you go, oh my gosh, what would we do? Or that's amazing what they did. I never thought of that. So you learn so much by being part of these characters as they're going through this story. And he's smart. He knows everything about prepping, and he puts all this stuff in there, and you learn, and you're like, oh my gosh, I never knew that I could filter water doing this. And you learn things. Am I right?
Yeah, you do. But the people in there had limited skills, and it was designed on purpose so you could see all of their failures. I don't know if you can see this, but can you see that character on the back of the book right here?
I know who that is.
Does that look like that guy that's sitting on the screen right there next to you?
Dr. Bones?
On the
Back? That right there on the back of the book. I don't know if you want to put that up for.
Oh, that's got to be. That guy looks sinister.
Okay.
That is a sinister Dr. Bones, who is actually the member of the group. Look at him carrying a firearm, and look at him, y'all, shirt hanging out. So
it's a great book. I love the way you weave a story, Charlie, and of course your survival group handbook. That's the Bible for having a harmonious group. So for goodness sake, if you guys out there don't have his book, please buy it.
Yeah,
thank you so much. Too kind.
And then Dr. Bones, tell us everything that is going on with you and Nurse Amy, and go for it.
I'm gonna keep everybody up to date with regards to the coronavirus. Everything that I write when I talk about preparedness assumes that some disaster has occurred and that you are now the highest medical resource left to your family. And my job is in plain English to make you work well in that role. So please check out our website at doomandbloom.net. Our books, we've been blessed to have popular books with the preparedness community. The Survival Medicine Handbook is now in its 3rd edition. Please buy the 3rd edition if you're going to buy one. I keep seeing people buying older editions. The 3rd edition is much more in detail. Each edition has been more in detail and has the latest information. That's the Survival Medicine Handbook, the essential guide for when medical help is not on the way. Our book, if you ever heard about fish antibiotics, I'm the guy who wrote the first article, or at least the first physician to write about them. And you'll find out about it in Alton's Antibiotics and Infectious Disease, the layman's guide to available antibiotics in austere settings. And we also have a YouTube channel. The YouTube channel is Dr. Bones Nurse Amy. You can follow me on Twitter at Prepper Show. We also have a Facebook group, 6,000 strong. It's called Survival Medicine, Dr. Bones Nurse Amy. And what else? Oh, and our podcast is called the Survival Medicine Podcast, and that's on Blog Talk Radio and, of course, other platforms.
Yes, and so I will tell you a story about Dr. Bones and Nurse Amy. They are passionate of what they're doing. This is not about the money for them. They're passionate. I had a friend, we were at one of the shows, and he had one of the first editions of this book, and it had yellow stickies all through it, and it was highlighted like you would not even believe. And Nurse Amy saw that, and I thought she was going to cry that someone spent that much time researching and going through her book. But she also was kind of sad that the guy had the first edition and not the latest edition. So she went down to her booth, got one of these, and gave it to him and said, "You need the new edition as well." Didn't even charge. I thought that was pretty amazing. That just spoke volumes from you guys. I do want to say, but thank you both for being here. Want to share with you guys, don't forget my book is free starting tomorrow. I don't know if that's midnight, to be honest with you, but it's free to download. You can download it. I'm going to go back because I want to see the schedule. Tomorrow night is Jonathan Hollerman, one of the best books I've ever read. Every prepper needs to read this. Beginning preppers, it's good for all people, but it's a different type of mindset than what I grew up as I was growing in my journey of being prepared. And then Lisa Bedford, she is called the Survival Mom. She is going to talk to us about the kids, how to manage the kids, everything there is about being a parent. And so little two different takes tomorrow night. We've got Sam Copler coming on Saturday and JJS. Glenn, Tate, and Shelby, they're married. And so you guys can see the list. We're going to do this. We just think that we hope this is very beneficial, training, learning. If you got questions, Charley has a website. He's on Facebook. Dr. Bones and Nurse Amy, send them. These people are approachable. These are not your average rock star. If you send Michael Jordan an email, he's not going to respond. I promise you. You send these guys, they're bigger rock stars. They make more money than, okay, maybe not. But these guys are the real deal. So get up with them, talk to them, subscribe. I think we got everything covered. We're at 11:09. That was 2 hours. To be honest with you, love you, Dr. Bones and Nurse Amy, Joe and Amy, but we've been on longer ones before, haven't we?
We have. We love answering questions and things like that. Unfortunately, I've probably seen about 100 different questions on here. I'm sorry that we're not going to have time to really get to them, but you can always contact me at drbonespodcast@aol.com. If you have a question, I'm happy to answer it. I may be a little late in answering it, but I will get to it.
Yeah, they're busy right now for sure. And you know what? We'll bring you back on and do a question night.
Yeah, sure. I'd be happy to do that. Call on me anytime. And I just want to say, Forrest, what you're doing for the preparedness community is really invaluable. I mean, a lot of people need an organization like PrepperNet to feel like we're part of a community. Preparedness community is indeed a family, and we have to stick together, and we absolutely need this kind of networking. So please support Forrest and PrepperNet if you can, and certainly there are a lot of great guests that he's going to have just in the next 2 weeks. Please don't miss a one of them.
Charlie, any last words? Are you coughing? Hey, do you have the virus?
No.
No, I'm good. No, thank you guys so much. I appreciate it. It's been great here. I know that there's going to be a lot of great shows coming up. Reach out to me if there's anything I can ever do to help. I'm always happy to come on. If you got any questions, group planning, any of the emergency management stuff, don't hesitate. I'm always here for you guys. You're doing an amazing service for everybody, and we love you all. So thanks so much.
Okay, guys, we're out of here. See you guys tomorrow night. Thanks to the guests. We'll take care, guys.
God bless.
All right.